Hi, my name is Kaitlyn and I am a registered massage therapist at Proactive Pelvic Health. Today we're going to talk a little bit about hip pain. We're going to talk about the signs and symptoms that you might be experiencing with hip pain. We're going to talk about a few management strategies that you can use, a few activities that you should be avoiding when you do have hip pain, and I'm going to provide you with an exercise that you can start to do when you experience some hip pain. The hip pain that we're going to be talking about today is going to be in the region of the image that is demonstrated on the screen right now. So it's going to be that pain on the outer bottom aspect of the thigh, and it's going to be painful in positions when you're lying on that side. You could exhibit pain when you're crossing your legs. It could be pain with exercise, walking, or running, and you could especially start to notice that pain when you're walking or running a little bit more quickly than normal, and that area is going to be more sensitive to the touch. What should you do when you are experiencing this type of hip pains? Well, first of all, let's book in with one of our physiotherapists and they can do a proper assessment on you to determine what is the cause of the pain that you're experiencing in the hip. But in the meantime, things that you can avoid doing to try to prevent exacerbating that pain in that area is avoid trying to sit and cross-legged. You're going to try to avoid sitting with your knees together. So we're going to sit with our legs just a little bit further apart so we're not putting any stress or strain on that hip area. You're going to try to avoid sitting in lower chairs because that lengthens the muscle of the glute region and puts extra strain on that hip region. And we're going to try to avoid sleeping on that side. So if your right side is painful, we're going to try sleeping on our left side, and we want to try to sleep with a pillow in between our knees. In the next few seconds, I'm going to demonstrate an exercise that you can perform to try to help to reduce your hip pain, but also help to try to strengthen the muscles within that area. So we're standing next to the wall. We have our left leg closest to the wall, and we are going to just push our leg into the wall and holding that position for 5, 4, 3, 2, 1. Coming back to center, and we're going to repeat that exercise 5 times. If you're experiencing any hip pain, your best course of action is to book in with one of our physiotherapists in order to do a proper assessment to determine the root cause of the injury. But in the meantime, you're able to use these management strategies to help to alleviate some of your pain until you're able to get a proper assessment done.